Hello, listeners. A warm welcome to Views on Health. And as yet another Monday evening comes by, it's a great pleasure to have with me on the program tonight Dr. Chathurika Beligaswatta, consultant nephrologist, and attached to the base hospital in Homagama, the Infectious Diseases Hospital, better known as the IDH in Sri Lanka, and the Colombo East Base Hospital, all three which are dedicated hospitals to treat COVID-19 patients. Interesting it is at this juncture with the virus and its variants being rampant in Sri Lanka. So in the midst of your very busy schedule, we truly appreciate you coming over to SLBC for the program today, Doctor, and we sincerely hope that our listeners will certainly take note of what you're going to share with them on the topic COVID and the kidneys. So the kidneys being Dr. Beligaswatta's specialty, being a nephrologist, I'm sure this will be of interest to our listeners and all those who are kidney patients listening to the program tonight. Welcome once again to our studios, Doctor. And for the information of our listeners, also Dr. Chathurika Beligaswatta is being featured in this series of programs for the first time. So warm welcome once again.
Thank you, Fatima. And first of all, I would like to thank Sri Lanka Broadcasting Corporation for inviting me over here to have this timely discussion on COVID and the kidneys.
So over to you, Doctor, to introduce the topic of COVID-19 and kidneys. And I would also like to, at the same time, ask you, are kidney patients at higher risk of contracting COVID-19?
Yes. So COVID-19 is considered to be a respiratory illness, but it's also been shown to take its toll on the kidneys. So people with chronic kidney disease are at higher risk of getting severe forms of this illness, and they're at higher risk of hospitalization, ICU care, as well as very poor outcomes. So especially if you have late stages of kidney disease, that is stage 4 and stage 5 kidney disease, which is also called end-stage kidney disease, and if you're in need of dialysis, and if you're undergoing regular dialysis, and also patients who are taking anti-rejection medications following a kidney transplant, and also patients who are on immunosuppressants for various kidney illnesses are at a higher risk of contracting the illness, going into severe forms of illness, high risk of hospitalizations and even death. So it is affecting kidney patients very quickly as well as in a very grave manner.
Thank you for that brief but lucid introduction and an answer to my question, are kidney patients at high risk of COVID-19? May I know from you, Doctor, as to why are kidney patients at a higher risk? What makes you say that? Obviously, you have your reasons medically. So could you share those with our listeners?
Yes, of course. I think patients with chronic kidney disease are at a higher risk of getting this disease due to various reasons. Most of the time, patients with kidney disease are elderly patients. So it's known that if you're over 65 years of age, you are at a higher risk of contracting the disease. So the same thing applies to patients with chronic kidney disease as well. And also, most of the patients with chronic kidney disease are also having coexistent other medical conditions like high blood pressure, diabetes, which make them more prone to acquire this disease. And also, patients who have kidney disease have a weakened immune system. So they cannot fight the virus, and they're inherently more prone to catch infections. And COVID-19 is very contagious, so they're at a higher risk of acquiring this disease. And also, a lot of patients who have received a transplant are taking lifelong anti-rejection medications to prevent their kidneys from being rejected. So when you are on anti-rejection medications, your immunity goes down, and then you are at a higher risk of getting this disease. So all these reasons make patients with chronic kidney disease more prone to get this virus.
Just a question, Doctor, before I go on to my other question. What about the younger patients who are afflicted with kidney disease? We have quite a number in Sri Lanka. Could you just briefly tell us about that category of patients and COVID-19 if they were to contract the disease?
Yes, so even young patients are at a high risk of acquiring the disease. And also, when you have kidney disease, generally your immune system is weak, very weak. So therefore, they have a tendency to catch the infection very easily. So just like older patients with chronic kidney disease, even young patients will catch this infection very quickly and will go into very severe forms of the illness. So it doesn't really matter whether you're young or old, but if you have chronic kidney disease, you are definitely at a higher risk of getting this illness and going into severe forms of the disease.
So how does it impact on the kidneys?
Yes, so there are various ways by this virus impacts on the kidney. So this is actually an evolving topic these days, and a lot of new information keep coming through. And so there are many ways by which kidney can be affected. So when you go into severe forms of this illness, it's very common that your blood pressure goes down because of several reasons. Maybe you're dehydrated because you lose your appetite, you don't drink or eat adequately. So dehydration, and also sometimes you go into a stage called septicemia, where this virus and secondary bacterial infections will invade your bloodstream and will cause sepsis, which can cause low blood pressures. And these low blood pressure is known to cause ischemia to the kidney, that is poor blood supply to the kidney, which can impact kidneys in a different way. And also when you have COVID-19, there's intense inflammation going on in your body, which also adversely affects the kidney. And also, in rare cases, you see patients with COVID-19 who also have severe muscle breakdown, which is also known as rhabdomyolysis. So all these can contribute to kidney failure. Plus, there's new evidence coming up that virus can directly invade the kidney tissue and cause kidney injury in patients who may not have pre-existing kidney disease, but who may have normal kidney functions, so they can also be affected by COVID-19 and go into a form called acute kidney injury.
In other words, doctor, the situation is bad in either way. You
Yes.
have a bad kidney, you have a kidney patient rather, it is bad.
Yes.
And then COVID is bad.
Bad,
So
yes.
I think it's like a double whammy, a combination
Yeah.
of the two.
Exactly.
Is difficult for the patients. Okay. Just to check with you also, what are the precautions therefore that one can take? I mean, you have the kidney problem, nothing you can do about it. Then, unfortunately, you contract COVID-19. So how does one sort of prevent or take precautions to be safe?
Yeah, so people with chronic kidney disease are at high risk of developing severe cases of COVID-19. So it's important that you take all the necessary precautions. So the general principles apply to patients with kidney disease as well. So you have to avoid crowds and keep 6 feet distance if you're in a public space. And you have to wear a high quality mask with a tight fit, or even double masking in public places. And you have to practice good hand hygiene. You have to make sure that you wash your hands regularly and carry a hand sanitizer wherever you go, and use it after touching and handling items which are used by many people. And you should always try and avoid touching your eyes, mouth, and your nose. And whenever you come back home, it's better if you can clean and discomfort items that you touch very often, such as your car keys, your steering wheel of the car, your phone case, credit cards, and etc. So I think these are practices that we should always keep doing in order to prevent catching this infection. So, and you have to actively look for symptoms of COVID-19 if you've been exposed to another patient with COVID-19, because sometimes you may not have typical symptoms of COVID-19, because as you know, everyone knows this as a disease which comes as a cough and a fever. But a lot of patients who have chronic kidney disease, who have been transplanted, who have very weak immune systems, may have atypical symptoms. So we've seen patients who come with low-grade fevers, which are not very commonly seen, and to have severe nausea, severe vomiting, loose stools. These are very atypical symptoms that they can usually present with. And as I said before, this is mainly a respiratory illness. So you may expect to have sore throat, some nasal congestion, runny nose, unexplainable feeling of discomfort or illness. headaches, body aches, and then joint pains. And some people lose their smell and taste. As I said, some patients go into severe forms of the disease where they feel very breathless. And in addition to cough, they may have trouble breathing, they may have tightness of their chest pain, pressure and confusion. And sometimes when they develop severe forms of illness, they become really hypoxic. The level of oxygen in their blood goes down and they can have bluish discoloration of their lips and the faces. So these are in the late stages of the disease. But if you're suffering from kidney disease, you have to be careful. And if you have any of these symptoms, or if you have been exposed to someone who has these symptoms, or who have been tested positive for COVID, who may not have any symptoms, still you have to be very cautious, and then you have to call your doctor immediately and seek medical advice.
See, Doctor, the situation is that already the kidney is an issue to be dealt with. And
Yes.
then while going on with that, it's a question of, having to be absolutely careful not to contract COVID in any way. And just a question, by the way, can't this be seen as stressful to a patient with kidney disease?
Of course, living with a chronic illness like chronic kidney disease or kidney failure itself is very stressful. And avoiding this COVID-19 infection is going to be even more stressful, because especially people who are on dialysis will have to go to their regular dialysis centers at least 2-3 times a week. And they may have to use public transport, and they may have to go outside their houses just to get their medical treatment. So they're at an increased risk of catching this infection from the general population. So I would say, yes, it is a very stressful situation for these patients with chronic kidney disease.
So going on from there, any special advice, therefore, to patients, especially those who are undergoing dialysis?
Yes, so as I said before, the dialysis patients are having end-stage kidney disease. So their kidneys are basically not working. So they need the support of dialysis to sustain their lives. So if you're on dialysis, it's extremely important to continue your scheduled treatment, and you should not miss out on any dialysis just because of the risk of catching this infection. So it's very dangerous to stop your dialysis treatment because of the fear of catching the infection. So it's important that you carry on with your scheduled treatment, but you have to be very cautious when you're going out of the house. It's better if you can avoid public transport, if you can go in your own vehicle. Not as easy as you say, but it's very important that you use a hand sanitizer wherever you go. Precautions which I mentioned earlier. So make sure that you have at least 2 weeks supply of medications with you just in case. And also, sometimes now these days, a lot of people are advising on social media to drink plenty of water, to take high doses of vitamin C, vitamin D, to boost your immunity. So we see a lot of dialysis patients also taking very high doses of vitamin C, but I would say this is rather harmful for patients who have late stages of chronic kidney disease and who are on dialysis, because high doses of vitamin C per se can cause impaired kidney functions and kidney failure. So it's very important that we don't usually go by all these advices that people publish on social media, and you have to always talk to your doctor, discuss with them about the options you have. And to be honest with you, no trials have proven the efficacy of any of these medications that people use these days would boost your immunity. There's nothing which has been proven to boost your immunity. So I would say not to waste your money and your time on these. So go for regular dialysis treatment, take adequate precautions to prevent contracting the disease. Do not stop your medications just because you are a kidney patient and you are at high risk of getting this infection. And if you have any symptoms suggestive of COVID-19, or if you have been exposed to someone who's got the disease or who's been tested positive for COVID-19, it's essential that you talk to your doctor and you inform your dialysis unit, because you are a threat for the other patients who come there if you go to these dialysis units without informing your doctor or the dialysis nurses. Because in Sri Lanka, we have dedicated centers or dedicated hospitals which carry out dialysis treatments for patients who have been diagnosed with COVID-19, because most of the hospitals do not carry out the dialysis for patients who are tested positive for COVID-19. So whenever you are having symptoms or when you're tested positive for COVID-19, you will be directed to a center where they provide dialysis treatment for patients with COVID-19. So such hospitals are mainly, we have one in Colombo, the dedicated dialysis hospital for patients with COVID-19. That's Base Hospital, Homagama. So we see a lot of patients being transferred to us, even from the private sector, for the sole purpose of dialysis. So it's very important that you notify your doctor and the dialysis team if you have any symptoms of COVID-19, because if you go there, if you walk into a dialysis center without telling anybody, there are so many other patients who walk into the same center to have treatment. So you might give this infection to someone else. It's very essential that you notify your doctor and your nurses about this.
Thank you, Doctor, for that very detailed and once again lucid explanation. And any advice to transplant patients? There are so many patients today who have undergone kidney transplant, and there are so many waiting to get transplants done.
Yes.
What would you advise them?
Whenever a patient receives a renal transplant, they are on lifelong anti-rejection medications to prevent their grafts from getting rejected. So my advice to patients who have got a transplant is do not discontinue or change how you take your medications, because it's essential that you continue these anti-rejection medications to prevent your graft from getting rejected, unless you are told by your doctor to alter your medications, because we see a lot of patients stopping their anti-rejection medications because of the fear of catching the COVID-19 infection. So please do not do that. Just continue your treatment as you've been advised by your doctor. If you have any doubts, you can always call your nephrologist or your transplant team and get their advice as well. But sometimes when you get admitted to hospital, when you show signs of low oxygenation and when you show signs that you're heading into a severe form of illness, we as nephrologists might alter your medications a little. We might stop certain medications, we might reduce the dose of other medications, but do not do it on your own. Always take advice from your nephrologist. That's essential. And also have a 2 week supply of medications always with you, because you shouldn't run out of your medications. And as I mentioned earlier, as for dialysis patients, even transplant patients, if you have any signs and symptoms of COVID, always inform your doctor, because it's essential that you get yourself tested for COVID-19 at the earliest possible time. Because if you are having COVID-19, it's essential that you are directed to a center which is dedicated to treat such patients. So at Homagama, Mullaria and IDH, we've got a lot of patients with COVID-19 who've also had a transplant. So we are managing these special patients in these 3 hospitals. So it's essential that you get yourself tested for this illness as early as possible. And you always have to liaise with your transplant doctor and your team.
So, Doctor, you said that certain vitamins, as sort of promoted on social media, are not proven to be sort of immunity booster, so to speak. Putting that aside, what about food, the diet per se? What would you recommend?
So there's no evidence that any specific food or food group can prevent or fight off the coronavirus. So you have to eat healthily, and you have to follow the dietary and the fluid plan suggested to you by your nephrologist or the dietitian, because as you know, when people reach the last stages of their kidney disease, they usually become anuric. So what anuria means is that they do not pass much urine. Some may not even pass a drop of urine. So in those patients, we usually recommend them a fluid plan. We ask them, okay, just drink 500 ml of fluids for 24 hours. But as I mentioned previously, there's a lot of advice circulating on social media, on papers, saying that you have to drink plenty of fluids, you have to drink at least 2-3 liters of fluid. But this doesn't apply to patients who have kidney disease and who have been recommended special dietary and fluid plans by their nephrologist. So just stick to what your nephrologist has suggested to you and eat healthily. Do regular exercise. So there's no specific food or food group that is proven to prevent this disease or to fight off the virus from your body.
So in other words, obviously, a kidney patient has certain do's and don'ts with the diet.
Yes,
And that has got to be followed.
exactly.
So if that is followed, would you say, as a consultant nephrologist, that that's what the patient should do?
Yes, that's what the patient should do, because we see a lot of patients coming with fluid overload. So as I said before, sometimes they may not pass a drop of urine and they start drinking 2-3 liters of fluids a day, and they come with severe fluid overload and they have fluid in their lungs, so they can't lie flat. They're really short of breath, and when there are circumstances, or there are instances actually, that where we have to increase the frequency of dialysis just to get this extra fluid out. And that might even worsen the underlying COVID-19 pneumonia. So it's essential that they stick to the dietary and the fluid plans suggested to them by their nephrologist or the dietitian. So you shouldn't do what other people ask you to do. You should follow the advice of your nephrologist or the dietitian.
Just a question, may not be that fair at this juncture, but in your day-to-day practice in these 3 hospitals, people being human, do they sort of break the rules, so to speak? I mean, do they not actually follow what the doctor has said, the nephrologist has said, do this, don't do this, don't do this, don't do this, don't do that, but they still tend to do it, being human?
Yeah, we see that quite frequently.
So do you see that in your day-to-day practice?
Yes, we see it very, very frequently.
Could be exasperating?
Yes. So I think, as you said, we're all humans. So sometimes you feel thirsty, and even if we ask them not to drink water, they just keep on drinking. So there are situations...
And then face the consequences.
Yes, then they face the consequences. So there have been a couple of deaths recently just because of that. Because we had a very young boy recently, because we've been advising him to drink 500, 400 ml of fluids, but he keeps drinking and drinking. And we had to do daily dialysis on him just to get rid of the extra fluid that he's drinking every day. But that actually exaggerated the underlying pneumonia he had. So he had to go to the ICU, and although with daily dialysis, we couldn't save his life. So I think these are common things that we see these days. But I think it's better if you can stick to all the advice given to you by a specialist.
Thank you, Doctor. I want to just get that point clear to our listeners, because I'm not sure, because basically consultants who come and sit before me week in, week out, in this series of programs, it's a common question that I tend to ask, whether they do follow doctor's advice. Yeah, A, B, C, D, E, etc.
There are patients who actually follow our advices.
Yeah, they do, but there are those who don't.
There are, especially young ones. Yeah, especially adolescents, adults. There are people who actually do not want to follow the advices that we give them, but they actually face the consequences of that.
So, Doctor, what about the vaccination? How important is it?
Yeah, there are a lot of misconceptions about the vaccination. I think it's very important that all patients with chronic kidney disease get both doses of the vaccination. It prevents you from getting a severe infection. It reduces the rate of hospitalizations, and it also reduces the rate of deaths. So I think it's essential that all patients who have chronic kidney disease get both doses of vaccination. Talking about the transplant patients, so it's recommended that you have your vaccination 3 months after you have your transplant surgery. And after that, you can be vaccinated at any time. It's very important that especially if you're taking these immunosuppressants, that is medications which lowers your immunity. There are a lot of patients with different forms of kidney diseases who are on lifelong immunosuppressants, not only transplant patients with various forms of glomerulonephritis. So there are patients who are on lifelong immunosuppressants. So it's essential that you talk to your doctor before you go for your vaccination. But most of the time, we recommend patients to have both their doses of vaccination, because that simply reduces the risk of getting a severe infection. It reduces the risk of death and hospitalization.
So, Doctor, would you recommend that a patient should get the vaccine if he has already got COVID-19?
Yes. So I think irrespective of whether you have got the COVID-19 infection or not, it's essential that you take both doses of vaccination. Because according to expert advice, a person who's had COVID-19 still needs to get vaccinated against the disease because the immune response from having the disease may not be as strong as the definitive response that occurs, or the defensive response actually, that occurs after vaccination. So I think it's essential, even if you have got the COVID-19 illness and if you have recovered from it, to go ahead and get your jab. We advise patients to go and get the vaccination 2 weeks after recovery from the COVID-19 infection. So talk to your doctor, go and get yourself vaccinated. That's essential in preventing severe forms of disease and death.
Doctor, your take-home message.
So do not take this lightly. It's a serious illness, especially if you have kidney disease, if you are a patient who's had a transplant, or if you are a patient who's on lifelong immunosuppressants because of some other kidney-related illnesses. So don't take this lightly. It's a killer, so be careful.
Thank you, Doctor. On that valuable note of advice, we end this very interesting discussion on COVID-19 and the kidneys. We place on record our very grateful thanks to Dr. Chathurika Beligaswatta, consultant nephrologist, attached to the base hospital in Homagama, the Infectious Diseases Hospital, better known as the IDH, and the Colombo East Base Hospital. All three are dedicated COVID treatment centers. Thank you so much, Doctor, for being with us.
Thank you for inviting me.
After a very hard day, I'm sure.
Thank you.
And enlightening our listeners on this very vital topic, topical also, COVID-19 and the kidneys.
Thank you.
Thank you, Doctor. My thanks also go to Nadira Manamperi for technical assistance. Thank you, Nadira. I'm Fatima Razi Kari saying good night and hoping to catch you next Monday, same time on Views on Health.